206 bones in the skeleton. Let's take a look at these, some related structures, and the joints that the bones make up. First, the axial skeleton is composed, as you see here, of the skull, the vertebral column, and that includes the sacrum, the ribs, sternum, middle ear bones, the malleus, the incus, and stapes, which you don't see in this image. And lastly, the hyoid bone, which is also challenging to see, if not impossible to see in this image. Those are the bones of the axial skeleton. Appendicular skeleton, as we can see right here, includes the bones of the upper limbs, lower limbs, the two innominate bones of the pelvic girdle. Please keep in mind that the sacrum, which makes up the pelvis, is part of the axial skeleton, not the appendicular skeleton. And then lastly, the two scapula and the two clavicles. So let's take a look at some of the joints in the body. The first one we're going to look at is the Synostosis Joint, otherwise known as a bony joint. And this is a result of bones that fuse at some point in development. They can be fusing prior to birth or after birth. In this case, we're looking at two innominate bones, and they are comprised by three distinct bones, the ilium, the ischium, and the pubis, that during development fuse to make the one bone known as the os coxa, that we also call the innominate bones. There's also a synarthrosis, which is a fibrous joint because the bones are held together by collagen fibers. And characteristic of these type of joints are the sutures in the skull as syndesmoses, which are two adjacent long bones like the radius and the ulna, which are held together by fibers and interosseous membrane, and also the tibia and the fibula, and the tooth socket, that is to say where the tooth articulates with the socket of the mandible, is known as a gomphoses. So suture bones, sutures, gomphoses, and syndesmoses are under the category of synarthroses. We also have amphiarthroses, which are cartilaginous joints, either utilizing hyaline cartilage or fibrocartilage to join adjacent bones. Symphyses, like we see here, utilize fibrocartilage to bind the right and left innominate bones. So this is the fibrocartilage right here. And we also see a similar fibrocartilage that makes up the intervertebral discs found between each vertebrae of the vertebral column. And there are also amphiarthroses known as synchondroses, which are the result of hyaline cartilage binding bone to bone. And a prime example of this is the first rib to the sternum, not the other ribs. We also have diarthroses, which are synovial joints. And these are really the joints that most people think about when they're thinking about joints in the body, such as the shoulder, the elbow, the knee. And they are composed of a joint capsule, which includes a fibrous layer right here, which is continuous with the periosteum of the bone. So this is the fibrous layer right here in gray. In orange right here, we see the synovial membrane. So the synovial membrane and the fibrous layer make up the joint capsule. There's always going to be hyaline cartilage protecting the ends of long bones that articulate with each other. It's often referred to as articular cartilage because that's where the bones are articulating with each other. So in blue on both of these bones, we see hyaline cartilage. And between all of this, we have a synovial cavity filled with synovial fluid. A couple other structures I want to mention. One are ligaments, which attach bone to bone. In this case, this is the lateral collateral ligament. All of this is written in French, I believe. And it's attaching bone to bone. In this case, the head of the fibula to the lateral epicondyle of the femur. We have another ligament right here, the anterior cruciate ligament, attaching bone to bone. In blue here is hyaline cartilage. Back here is a posterior cruciate ligament. And we also have tendons. This is called the quadriceps tendon because it binds the quadricep muscle to the patella, which is a small bone of the knee. Tendons attach muscle to bone, whereas ligaments attach bone to bone. And between the femur and the tibia right here, we find a fibrocartilage known as the meniscus. And this is somewhat of a misnomer right here, or maybe there's differences of opinion. Some books, individuals refer to this as a tendon, and some refer to it as a ligament. I am more inclined to call it a ligament because it's going from bone to bone, but it's somewhat confusing because it's also continuous with the patellar tendon, with the patella really just embedded with that really thick fibrous connective tissue. Okay, that's it for all those structures. We'll move on to more bones in the next video.